Hello everyone, this is Shinsi from Nursing Manthra. In today's video, we talk about NCLEX-RN examination, National Council Licensure Examination. How to prepare for NCLEX-RN examination? What is the syllabus of NCLEX-RN examination? What are the changes in new generation NCLEX exam, which is going to start from April 1st, 2023. You have to prepare for NCLEX in advance at least 6 months prior. You have to spend your 60% of your studying time for your weak areas, and rest of the time you can refresh the strong areas. You have to prepare the mock test, continuous mock test. You have to go back to your wrong answers and review. Don't only write your points, okay, how much score you have got. If you fail, you have to go back with the wrong answers and you have to review the rationale and everything. It is suggesting that if you are taking a 6-month continuous study plan, practice at least 50 to 100 questions per day. You have to focus on critical thinking questions. Attend the theory classes for your weak areas, then attend the question again. If you fail the NCLEX examination, don't book the exam immediately. Take time, relax, then study again, then only take the exam dates. If you are practicing in the morning time 60 questions, suppose you are practicing 60 questions in the morning time, do the content review related to that question in the afternoon section. Most of you are working and you will not get enough time for studying. For them, you can practice at least for 1 year also. Always you have to prepare the notes. So, note down your weak points whenever you are practicing the questions, and you can prepare your own study plan. You have to stick on your study plan. Try to make a tiny cheat sheets for review of one topic and make your own book for the theory notes and all, so that you can review easily for your last 2 weeks before the examination. You can do the review at least 5 to 7 times before examination. Try to depend on few question banks. You will get confused and it will feel very difficult also. So, try to focus few question bank, because the questions which is asking in NCLEX, that is not same from all the question banks which is providing. The content is, you have to understand the basic concepts, the keys, the points, everything in your mind. Then from wherever the question is asking, it is easy for you to answer the questions. Always you have to reassess your weak areas. Suppose if you are weak in identifying the ECG, or if you are weak in drug calculations or critical care questions, you have to focus more on that. And another important tip is, don't depend on someone else's study habit to pass the exam, because their plan of study, it may not be suit for you. Regarding the NCLEX-RN examination, that is new generation NCLEX-RN examination, which is effective from April 1, 2023 through March 31st, 2026. 3 years same pattern will be there. So, this computerized adaptive testing CAT exam, in this what all are the changes happened? All candidates must answer 85 items. Previously it was 75, now it is 85 items. Maximum number of items that an RN candidate may answer, that is 150 questions. During the allotted 5-hour time duration is there, 150 questions is the maximum questions. 85 questions must answer should be correct. 52 of the item will come from 8 content areas. Content areas I will discuss later. So, from that content areas with percentages, from the 52 of the items comes, which comes before also same content areas are there, from there the questions are come, items questions will be there. And 18 of the items will comprise 3 clinical judgment case studies. That is the new changes in new generation NCLEX series. They will provide us the case studies. So, each case study they will give initially they will give some information about the patient, same like nurses progress sheets, they will give the vital signs of the patient and with the date and laboratory values they will provide, and the question will be there and we have to select the answer. Then we have to click on next. In the second question related to same case scenario, the second day progress and all it will be there, and some changes will be there in the vital signs, and like that they will add, and second question we will move. And when we are moving with the third question and all, we will understand that the first question, okay, what is the answer for the first question, we will easily understand. But the problem is we can't go back. Even if we answer wrong, we can't go back to that previous question and we can't correct it. So this is the issue with the case studies. So in each case study it will contain 6 questions will be there related to that case scenario, that patient. You have to think that in front of you the real patient is there and patient is having, like that case studies you have to focus on. Okay, in front of you the patient is there. Okay, today the patient condition is this, and tomorrow when you are going for duty the patient condition is changes, laboratory values got changes, and like that you have to imagine a patient whenever you are attending case studies. Okay, and that contains 6 items will be there that measure of each 6 domains. Which all are the 6 domains means recognizing the cues, then analyzing the cues, prioritizing hypothesis, generating the solution for the problem, then taking action, what is the action you are taking, and evaluation of the outcome of the patient. These are the 6 domains. So these domains includes the 6 items for the case studies. Case studies will span any number of content areas and therefore counted independently. So this case studies it will count independently. Anywhere they can keep the case studies during the examination. The remaining 15 items that will be unscored, like pre-test items like that. It will be unscored, but we do not know from where which questions they are calculating as pre-test items, okay, like that. So you do not want to think about the pre-test, okay, first do not think that first 15 questions it will come for 50 pre-test, any answer I can keep, like do not do like that. Based on the pre-test only they are giving the questions and analyzing the scores and all. So always think that all question is important and write the exam well. The 5-hour limit to complete the examination include all breaks. Length of examination is determined by candidate's response to the items. Candidate can spend 1 to 2 minutes per item. Okay, whenever you are practicing a question, you can spend 1 to 2 minutes. Then in the exam hall also, it will be automatically you will use 1 to 2 minutes per item. There is no time limit for a candidate to spend on each individual item. If you do not know some questions and you are not sure and you need more time, you can take more time and you can answer it. If you click next only, it will go for next section. Once you click next button, unable to return to the previous item, that is very important, and so take time and read the question well, answer well, then only you can move to the next question. Every item must be answered even if the candidate is not sure of the correct answer. You can't leave the question unanswered. If you answer, then only it will go, like a computer will allow you to go for the next question. Now we can see the percentage categories of NCLEX-RN examination. So there are mild changes in the percentages are there, but content area is same comparing to previous NCLEX-RN examination. So first one is safe effective care environment. In safe effective care environment, there is management of care and safety and infection control. Management of care about 15 to 21%, safety and infection control 10 to 16% score will be there. And second one is health promotion and maintenance 6 to 12%. Third category is psychosocial integrity 6 to 12%, and fourth category physiological integrity. In physiological integrity, there are basic care and comfort, that will be 6 to 12%, pharmacological and parenteral therapies 13 to 19%, reduction of risk potential, that is 9 to 15%. Physiological adaptation 11 to 17% will be there. Integrated process throughout the client needs. They will check the caring, then clinical judgment, communication and documentation, culture and spirituality, nursing process, teaching and learning, all these related questions will be there. So, we can go with the detailed syllabus of NCLEX-RN examination. We have seen the percentage of each section. We will be having doubt, maybe microbiology, nutrition and biochemistry, psychology, so many subjects in the nursing when we are studying the nursing, sociology, all these has to study or not for the NCLEX. So, NCLEX have a strategic plan related to the syllabus under each category. So, we will check which all are the content we have to focus under each speciality. So, first content is safe and effective care environment. In safe and effective care environment, first part is management of care, that concludes 15 to 21% of the questions. Management of care, under that advanced directives, self-determination, life planning, advocacy, assignment, delegation, supervision, case management, client rights, collaboration with multidisciplinary team, concepts of management, confidentiality, information security, continuity of care, establishing priorities, ethical practice, informed consent, information technology, legal rights and responsibilities, performance improvement like a quality improvement, referrals, all this comes under management of care. So, the topics related from this, it will be under management of care questions. Next part is safety and infection control, which contains 10 to 16% of the questions. Accident, error, injury prevention, emergency response plan, then ergonomic principles, handling of the hazardous and infectious materials, home safety, reporting of incident, event, irregular occurrence like OVR and all, occurrence variance report and all, safe use of equipments, security plan, standard precautions, infection related precautions are there, airborne precautions, standard precaution, transmission based precautions, surgical asepsis, gowning and downing, all these things, okay, use of restraints, safety devices, all this comes under safety and infection related questions. Next content is health promotion and maintenance. Health promotion and maintenance, it will come 6 to 12% of the questions. In that, the areas are aging process, antenatal, intranatal, postpartum and newborn care, developmental stages and transitions, health promotions, disease prevention, health screening, high risk behaviors, lifestyle choices, self-care, then techniques of physical assessment, all these topics are content under the health promotion and maintenance, it will come. Next, our content is psychosocial integrity. It is 6 to 12% of the questions. In that, the abuse, substance abuse, drug abuse, alcohol abuse, like that, then neglect of the adult and child, all elderly, all these things, then behavioral intervention, chemical and other dependencies, substance use disorder, cocaine use, like that, chemicals, drugs and all, coping mechanisms, crisis intervention, cultural awareness and cultural influences on health, end of life care, family dynamics, grief and loss, mental health concepts, religious and spirituality related influence on health, sensory and perception alterations, stress management, support systems, therapeutic communication, therapeutic environment, all these comes under psychosocial integrity. Next, we have physiological integrity. Under physiological integrity, we have a basic care and comfort, that is 6 to 12% of the questions. Basic care and comfort, under that we can say assistive devices, elimination, mobility and immobility, non-pharmacological comfort interventions, nutrition and oral hydration, personal hygiene, rest and sleep related questions will be there. Then second category is the pharmacological and parenteral therapies, that is 13 to 19%. In that we can see the medication adverse effects, contraindication of the medications, side effect, interaction of the medication, everything we should know. Blood and blood products administration and the side effects, okay, okay. Then central venous access devices, dosage calculations, expected actions, then outcome, medication administration, parenteral or IV therapies, pharmacological pain management, total parenteral nutrition TPN, all these related questions will be there under pharmacological and parenteral therapies, which contains 13 to 19% of the NCLEX questions. Then reduction of risk potential, that contains 9 to 15% of the questions. In that we can see any changes or abnormalities in the vital signs, diagnostic test, laboratory values, potential for alteration in body system, or any post-op cases like surgical procedures, complications, any health alterations, complications of a diagnostic test, treatment or any procedure, system specific assessment, therapeutic procedures, all will come under reduction of risk potential. And physiological adaptation, that is another category, it comprises of 11 to 17% of the questions. In physiological adaptation, alteration in the body systems, our respiratory system, cardiovascular system, all the system alterations, okay, any changes, fluid and electrolyte imbalance, hemodynamics, illness management, medical emergencies, how to react with the medical emergencies, pathophysiology, unexpected response to the therapies, all these comes under physiological adaptation. Next our content is psychosocial integrity. It is 6 to 12% of the questions. In that the abuse, substance abuse, drug abuse, alcohol abuse, like that, then neglect of the adult and child, all elderly, all these things, then behavioral intervention, chemical and other dependencies, substance use disorder, cocaine use, like that, chemicals, drugs and all, coping mechanisms, crisis intervention, cultural awareness and cultural influences on health, end of life care, family dynamics, grief and loss, mental health concepts, religious and spirituality related influence on health, sensory and perception alterations, stress management, support systems, therapeutic communication, therapeutic environment, all these comes under psychosocial integrity. I am excited about this opportunity to help you achieve your goal and hope you will not only learn but actually enjoying studying with Nursing Mantra. Keep your game face on, do your best and move on. I wish you all the best for your NCLEX examination. Thank you so much for watching.